To approach you?
No. What the girls were saying, one of the major issues they presented was initiation ceremonies. And when you asked them to unpack it, they were saying as soon as you start your first period, they lock you in the house. The girls were talking about how these men, some farmers and just some men would, when they come to town, they go back with things like hungry lion. And the transactional sex that is happening. We need more families to be able to access the social protection programs, the economic empowerment programs that exist. And sex is something that is very sacred. And this sex is something that we believe should only be had by adults. In schools, we have reports of teachers that have sexual relations, that sexually harass learners, and this is wrong. And these are conversations that we've had even with the Ministry of Education. So if you know that the neighbor is busy defiling their children, what do you do? And you're supposed to go and report as a good citizen and neighbor.
Interesting. So they are not there to fight.
You only fight when you fight her.
Welcome to the Smart Podcast. Indeed, yet we have a special guest and a special discussion focusing on issues affecting a number of youths we have around the country, and of course how they are having access to certain information and educational materials. On the Smart Podcast, of course, it is proudly brought to you by Elitrasmart Medical Supplies Limited, our number one sponsor, and of course the number one provider of healthcare attire across the country. So if you're a nurse, a doctor, or a pharmacist working in that hospital, Elitrasmart is the number one company to go to if you want to look smart and of course beautiful in your working attire. My guest today is Womba. She's known for her work in the civil society, advocating and of course talking on girls' rights and ensuring that their rights are heard and their voices, of course, heard in places where they wouldn't want to be heard. So Womba, welcome to the Smart Podcast.
Thank you very much, and thank you for having me.
Okay, great. Now, for starters, your name is known in the civil society and just in the NGO world for leading a youth-based organization. Just tell me about Generation Alive. What do you do?
Generation Alive is a Zambian feminist youth-focused organization working to promote the rights of women and girls. We want to raise the generation of feminist leaders who can participate at all levels of decision-making, especially on issues affecting and informing their lives. So we work around different thematic areas. We work on health, we work on gender equality, work on climate justice, work on economic strengthening, among others. So our work involves responding to issues affecting women and girls primarily. HIV, low access to sexual and reproductive health and rights, feminist leadership, homelessness. We do a lot of work with children and young people living in street situations. Low participation in leadership and decision making. We work around political participation of women, and we also work in response to gender-based violence, particularly violence against women and girls. And you've heard that my language is basically women and girls, but that doesn't mean we do not work with men as well. We do work, we're very gender transformative. We work with men and boys through community action groups. We do a lot of advocacy work, and so you will find us engaging members of parliament, engaging permanent secretaries, engaging civil and community leaders, civic and community leaders, and you will also find us engaging faith leaders and also traditional leaders.
Should young men be scared to approach you?
No, they shouldn't. They are welcome. We're open. In as much as our priority is women and girls, like I said, we also have the men and boys. We have community action groups for men and boys. We just call them the men and boys clubs. That essentially also promote the rights of women and girls by being champions of change. And we have realized that looking at some of the issues that we work on, we cannot really respond to them effectively without engaging the different structures, which include men and boys. We have what we call the Power to Girls advocacy groups. These are girls aged 10 to 18 that do a lot of advocacy work, feminist leadership in the school clubs as well. And the boys were complaining for a long time. So we also have groups for boys aged 10 to 18.
Okay, interesting. At corporate governance level, feminist leadership, should the men in leadership position be scared of feminism?
No, and I don't understand why people are so afraid of feminism. Feminism is basically an ideology that promotes equality between the genders. It takes a historical perspective. Men have enjoyed from male privilege for a long time, benefited from patriarchy. All we're trying to do is be equal.
Okay.
So don't be afraid.
There could be some misconception because the idea is the women now wants to take charge of institutions. They want to be CEOs, directors, and then they don't want to be challenged. So they are coming up the feminists trying to speak out. And for them, you find that for them they are saying no, it's actually affecting marriages and relationships.
You know why I'm happy to be here? I'm happy this is not live because this is the conversation I have had many times with ZNBC, and people have been calling in and saying a lot of things. Is having women in leadership such a bad thing? No, it's not a bad thing. Is having women fight and prove themselves 3 times more than men should, just so they can lead. That is very wrong. So for me, there's nothing wrong with women wanting to be in leadership, but there's everything wrong in making them have to work 3-4 times more than a man in order for people to take them seriously. And there's also misconception around being challenged and all that. I don't think the issue is we do not want to be challenged. We want to have conversations. Sometimes we're going to be angry. You would be angry also if you were part of a gender that had been disadvantaged for generations and generations and centuries and centuries. And I'll give a very practical example. We have a program that supports governance, women's participation in politics. And we have T-shirts. At the front, they're written, "Vote like Julia sent you." And at the back, it's written, "If you are able to vote, stand for office, etc., thank a feminist." And every time I'm in that T-shirt, I get a lot of backlash with that. But it's basically communicating a point that there are women who came before us who had to fight. Because even in Zambia, as recently as the 80s, women had to get permission from their husbands to open bank accounts. Is that what we want? We want women to lead because they have the lived experience, they have lived the reality of being disadvantaged, and they can represent the interests of women better.
Interesting. So they are not there to fight.
No, we're not fighting. We only fight when you fight us.
Interesting. Now, part of what you mentioned, what the works that you do as Generation Alive, is ensuring that girls have right to good health. Now, just maybe highlight some of your organization's work in terms of sexual and reproductive health rights. What are some of the works you are doing?
We raise awareness on human rights generally, and particularly sexual and reproductive health and rights. We help young people, particularly young women, girls, and boys, understand what these rights are. We also facilitate the provision of health services, including mental health and sexual and reproductive health services. We establish what we call girls and boys clubs within the community, where different issues pertaining to sexual and reproductive health and rights, GBV, leadership, gender equality are discussed. And we also help in the creation or establishment of the youth-friendly spaces at health facility, at community level. We provide technical and material support and also ensure that these platforms are safe, secure, And there is also an aspect of confidentiality. There's also an aspect of accessibility, because we work with young people um, in their diversities, and this includes young people with disability
Okay. Interesting.
and those living in street situations, and those in rural communities, and also young mothers.
Okay. And what would you say is the importance of the work you are doing in terms of advancing this information, educating them through different strategies you've mentioned? What could be the importance of doing that?
What we want is to see assertive young people, is to see confident young people, is to see young people who understand what their health needs are, what their sexual and reproductive health needs are. Young people who understand what sexual and reproductive health is, what the rights affiliated with this are. Young people who are able to understand things as basic as puberty. People who are able to understand things such as adolescence, people who are able to understand what early sexual debut can translate into, what having sex can translate into, young people who can speak to and understand that we have sexually transmitted infections. What are they? How do you recognize this? Young people who understand HIV, and young people who understand the intersection of all these issues that I have mentioned with health generally, with this climate change, with GBV, with child marriage. Because I think we have always had a misconception when people hear about sexual and reproductive health and rights, and the first thing they think of is, especially when it's in relation to young people, the first thing they think of is, we are encouraging young people to have sex. We are not. We are encouraging young people to make informed decisions, and one of the things that we encourage is delayed sex. But one thing you need to understand is adolescence, for example, is a very critical stage in a young person's life. We have been adolescents before, and we know what kind of period that was. So what we do is provide an environment that is conducive enough for these young people to be able to ask questions. And in these spaces, we've also been able to interact with parents. Because remember, we're coming from a time where the extended family system, the community structures, were things that you could marvel, and everything was considered family. It was easy for a young person then to go to a neighborhood grandmother, a neighborhood auntie, ask questions, and they would be responded to. But with the breakdown, young people have not had where to go, and sometimes they may not even be able to have these conversations with their parents. So our role is to ensure that we provide a conducive environment for young people to be able to develop a certain level of awareness, assertiveness, the confidence, and be able to understand what their sexual and reproductive health and rights are, and other rights, and also be able to speak to them, be able to claim information and services, and also be able to engage with parents, guardians, and other adults, and also health practitioners and providers.
Okay. In the safe spaces, you having interactions with them, what kind of questions do young people ask, especially with issues relating to sexual and reproductive health?
Young people are very interesting beings. I have taken the time to sometimes sit in the spaces because I'm young at heart now. I'm not young anymore. And they use languages that we don't understand, but we realize we're young ones. We gave nicknames to our parents. Oh, lion has come, Mufasa. We used to call my dad Mufasa. Has come, and just you behave. So you created your own languages and your own words. Young people do that. So you will be in a safe space. They ask you questions, and they're talking about things. What is X and what is Y, or what is this and what is that? They all laugh, and you're there as the adult wondering what they have talked about. So young people are asking about if and when they can have sex, for example, what the consequences are, where they can seek help, where they can do all that. And these are the conversations that they are having. Our role is to ensure that the space is able to provide relevant, comprehensive, age-appropriate information. And where services are required or further information is required, we provide a referral service to them. We have what we call the Creating Linkages, which is basically made up of organizations working with young people and who provide services So this platform is where we're able to provide the different services. Is it access to justice? Is it an SRHR issue? Is it mental health? Is it a GBV issue? Is it just general information, for example? But in the safe spaces that we have, these are very safe, these are very secure, the confidentiality is guaranteed.
Interesting. Now I understand your work actually dates beyond 2018 going down. 2018 you established now formally Generation Alive, but your work started earlier, and we've had other CSOs like the NAKEs and working together with the GEAR Alliance, trying to advance these rights. What are some of the challenges are you seeing affecting the sexual reproductive health rights, especially in rural communities?
Generation Alive actually started as a feminist movement. We used to meet outside people's homes. We used to meet under trees. I recall the late Edford Ntuma. He was the PPA's the executive director then. He allowed us to use their conference room at the health facility there. And so we were formed with the realization that we needed young women and girls at the table where conversations related to them and their lives were involved, where leadership was involved. And that's how we started. And as an organization, we started our relationships even before we became a formalized organization. And in our work, we work with different organizations, including NAKES. NAKES is a very good friend of ours as Generation Alive. And we have been in their engagements, they have been in ours, and we have done things together as well. And in their implementation, as the GEAR Alliance, I think they're not only working in the urban areas, they are working with other organizations such as ours, and we are in the rural communities. So when it comes to sexual and reproductive health and rights and some of the challenges or barriers that are being faced, particularly by young people, I think there is one which we mention all the time, and that is maybe attitudes of health providers. We may have a lot of health facilities that are being built or that are being in existence, but we need to understand that in order for a health facility to serve or respond to serve young people or respond to the sexual and reproductive health needs or any other needs of young people, they need trained and qualified staff and individuals and volunteers who have been trained to respond to the needs of young people. So if a young person goes to a facility and the people that they find there have not been trained to respond to their needs, you will find that there'll be a lot of discrimination, there'll be a lot of stigma, there'll be a lot of personal beliefs by the people that they find there that are going to influence the way they're going to respond to young people. So you will find that these are people that they may know, and they might tell their parents. The aspect of confidentiality is not there. Accessibility for young people with disability. You'll find that the facility does not have someone who is trained in sign language for interpretation, for example, and they will have to bring in an extra person in the event that there is one. They can't respond to those who are visually impaired. For example, they would not be able to respond to those who have physical disability because the place is not accessible enough. And for the other young people, they have a fear that if they go to a facility, then the person that they find is going to tell their parents, is going to judge them, is going to ask them why they have gone there. And sometimes there's just a general fear that if they go there, they will be turned away. So that presents a challenge.
Have you had cases where professionals at the facility had reported some young people went to a facility to ask for for a service?
For us, every facility, every health worker we work with, we train them on how to respond to the needs of young people. We have even gone as far as training health providers on how to respond to the mental health needs of young people in street situations and other vulnerable young people. So for us, what we see is you have root causes, such as personal beliefs and values. You have things such as societal perceptions and beliefs. So we need to understand that in order to transform those social norms, it takes a lot. So you do what you can and try and conduct trainings around values clarifications and attitude transformation, conduct trainings on how to respond to the health needs of adolescents and young people, engage traditional leaders, engage traditional counselors, engage different people within the community who have a very important role to play because they are so important. They are community champions and everyone listens to them. So if these become your champions, they are able to speak to other members of the community, including the health providers, on just how to ensure that the health facility is welcoming, conducive, and is adolescent and youth friendly.
So young people can be assured that whenever they visit...
Young people can be assured. Remember, we also have the adolescent health strategy, which guarantees that young people can go to a facility and access services. And it's also, the right to health is a basic right. It's in our constitution in part 3, the Bill of Rights. You have the right to health. When you look at the Children's Code, this is my Bible when it comes to young people, in section 11, it talks about the right to health for children. So the law provides that the right to health should be respected, should be responded to, and young people, adolescents and young people should enjoy it.
Okay. I would also like you to speak to the aspects of, because we have the Bill of Rights, of course, and of course now the issue of government making a conducive environment for young people. But maybe even before that, you touched on the aspect of barriers, even in accessing young people, especially in rural communities. What challenges are there when it comes to cultural norms, traditional practices, when you are doing your work in terms of advocating for rights of young girls, especially in rural communities? Because those are rights, information going to them as new information against some of the things they believe in. Do you have some case studies or scenarios where you've experienced challenges when you are advancing these rights to young people?
We have been very clever out of lessons, obviously, because you need to understand when it comes to sexual health, reproductive health, this is something that people treat with a certain sanctity, because the first thing that they think about is sex, and sex is something that is very sacred, and this sex is something that we believe should only be had by adults and adults who are married. But when you look at the evidence on the ground, Zambia has only seen a reduction of 1% when it comes to teenage pregnancy, from 29 to about 28. So already that raises questions to say we have all these interventions that we're implementing, but adolescents and young people are still getting pregnant. What does that say? That says we need to interrogate the social norms that exist, the veil of silence that exists. So when it comes to sex in itself, we need to demystify it. I'm not promoting sexual activity. I need to make this very clear. I'm not promoting sexual activity amongst children, but I am telling you that we have seen evidence of sexual debut. Just in the last 2 weeks, I've been in processes where UNFPA, who undertook what they're calling a deep dive in the Zambia Demographic Health Survey around HIV, teenage pregnancy, child marriage, GBV, they actually unpacked the Zambia Demographic Health Survey, went all the way up to subnational, the community level, to look at the statistics where you're finding teenage pregnancies as high as 40%, 45% in some areas. So in as much as we have laws that are protecting, we need to understand that young people are still having early sexual debut, and the conversations, those social norms, cultural norms that you're talking about, the conversations are still about you cannot discuss sex. So what we have been doing is engaging the traditional structures. Traditional structures are the traditional leadership, the chiefs, they are indunas. Also, they are head persons also, and also engaging traditional counselors. Traditional counselors are demonized, and understandably so, because they promote harmful cultural practices, such as harmful initiations. Harmful in the sense that they are teaching girls about marriage, about sex, about what. But then on the flip side, after awareness, you understand that they are a resource that can be used to transform these social norms, because in those initiation ceremonies, they will be able now to discuss only issues such as delaying sex, issues such as hygiene, issues such as identifying the different changes that happen in your body as an adolescent, onset of puberty. What is it? What are the signs to look out for? What are the things that you can prevent, for example? And what happens if you have sex? One of the results of that is a pregnancy. Another result is HIV, STIs, etc. So we have realized that in order to respond to some of these, if not all, of the harmful social norms, practices, and beliefs, it's important to engage traditional structures. Why? Because these social norms as they exist, some of them are the reason why young people are not able to enjoy their sexual and reproductive health and rights, because they believe conversations around sex, around hygiene, around adolescence, around puberty can only be discussed within the confines of secrecy and guided by traditional counselors, and and that you shouldn't have the conversations out in public. So in our engagements with all these traditional structures, we are able to demystify and we're able to have conversations freely. But that hasn't been easy. I recall a meeting that we had, some meetings in one of our implementation areas, Itezi. We had two groups of traditional counselors. There are some who are saying we don't need to change what the girls are taught because that is our culture. It's been there with us for centuries and centuries. And there was a group that was saying we need to understand that what we are doing is harmful to children. So we need to change how we do things, because in all the group work, in the plenary, in the discussions, what the girls were saying, one of the major issues they presented was initiation ceremonies. And when you ask them to unpack it, they were saying, as soon as you start your first period, they lock you in the house. You miss school. And there, if your family allows you to go to school, you go with someone escorting you. So you have your chitenge, you have your what in class, and automatically everyone knows you've started your period, you are an initiate. And they were saying they couldn't play with their friends because they were now being told that they were women and they couldn't play with young people, and they were being taught things that they didn't believe they needed to learn because they were so young.
How should young people in such rural communities especially now navigate those challenges? Because it's them against their parents.
That's where we come in. We provide a buffer. We also we serve as a buffer. We are also the bridge between the children and the parents. So we are able to provide platforms where honest conversations can be had and between the children and the parents. And we're also able to have conversations separately, facilitate the conversations for parents with their fellow parents, with traditional counselors, with traditional leaders present. And some of the traditional leaders that we have worked with in the areas that work in. I'll give an example of Chief Chikaza Munyama in Itestezi. Chief Chikaza has not been playing, because for him, even where he hears there's a child marriage, there was a defilement, he's going to mobilize his anti-GBV committee. He's going to go. He has been retrieving girls. He has been reporting to the police, and he has been doing that. That's why I'm saying traditional structures actually work to the benefit of the country. Because once they understand that the same tradition and culture that oversee is harmful to children and their communities, then they act and create bylaws that protect children and are aligned to statute.
What else? You spoken to laws, of course, initiated by the government. What else do you think the government should do in order to ensure that equitable access to these rights are achieved?
Resourcing. For me, I believe it's about resourcing. It's about resources in terms of money, material resourcing in terms of properly furnished youth and adolescent-friendly spaces, resourcing in terms of trained human resource, so investing in that. It's also about investing in partnership with both state and non-state actors such as ourselves, the CSOs. We already have the relationships, but it's about, I think, scaling up the relationships that we may have. And I must say that CTF has benefited a lot of communities. We've seen health facilities being built, etc. So it's about ensuring that every health facility, as they're being staffed, have a focal point for adolescent and youth who is trained to respond to their needs and understand them. Because every health facility has an adolescent and youth health focal point.
Interesting. I think just to also ride on what you've mentioned, we've seen a lot of facilities being built. Almost each constituency as that facility, and of course you are quite doing a tremendous job in ensuring that the young girls are educated, have right information, and of course with parents, and of course I think that talk you're having with them is helping even when their children or their young girls are making certain decisions. They are even able to allow them or even share the information with them. But also, let's speak to just there. Much work has been done. Much more work needs to be done. What are some of the gaps that that still exist in order for these youth-friendly corners or the SRHR services?
For me, I'm a legal and policy expert away from my gender work, so my response is mostly going to be aligned to that. I think we need just implementation or enforcement of the laws. And for me, I believe once that happens, then we're going to see a lot of progress. And right now, currently the Ministry of Health has been drafting the Health Services Bill, which is going to cater to SRHR and the health needs of adolescents and young people. For me, that's the kind of progress that we need as a country. And as a parent ministry, I know that once the law is passed, they'll be able to build capacity for members of staff to understand what the law says and what their role is in ensuring access to information and services for everyone, including adolescents and young people. And another thing I thought about, one of the issues that we have that affects sexual and reproductive health is poverty. Because you need to understand that there are some communities or families that are so poor that they end up marrying off their children. They end up charging men who have sex with their children instead of reporting to the police. That girls end up in transactional sex for money, for food. In Womba, or was that Chisamba, one of the communities we were having our activities, the girls were talking about how these men, some farmers and just some men would, when they come to town, they go back with things like Hungry Lion. And the transactional sex that is happening is for Hungry Lion. So for me, we need more families to be able to access the social protection programs, the economic empowerment programs that exist in the country, because we realize that once poverty has been responded to, then the family will only now have to deal with issues around adolescence that the child is experiencing, and they'll be able to have conversations around that as long as they are capacitated.
What punishments are there for parents marrying off their young girls?
When you look at the Education Act, if you marry off a learner, it's a minimum of 15 years. If you marry off a learner, facilitate the marrying of a learner, you'll be treated as though you had actually married off a learner. And when you look at the Children's Code Act, the Children's Code Act also has penalties. I don't know how many millions of penalty units that translates to. A penalty unit is 1/50, or is it 15 ngwe? You calculate like that. And there's also prison time that a parent who marries off a child, a guardian who marries off a child, there are penalties to that once they're reported and it's taken up. And the DPP, the Director of Public Prosecutions, has been very clear with his staff. He has told his prosecutors, as long as you receive such a case, you prosecute it. But you need to understand that for every case, not just for child marriage, but for defilement, for GBV, any other GBV, there are times, some cases end at the police station.
Mm-hmm.
And so, which is why a lot of work is being done. The VSU is leading some of the programs around responding to some of these issues, just raising awareness to say, don't encourage mediation or conversations between families, because some of these things need to be dealt with. But also, we need to strike a balance, because for some families, they're saying it's poverty. For some of them, it's cultural beliefs.
Mm-hmm.
So it's about striking a balance to ensure that we transform some of these social and cultural beliefs. And also, we link families to social protection programs so that they are not able to use poverty as an excuse. So we need to respond in order to deal with the vulnerabilities that exist, that place families and children in a position where they are being made to participate in promoting these harmful practices such as child marriage.
Okay, interesting. I am meant to believe that many of our young people now have access or a fair share of education. They are going to school. What do you think schools, colleges, or even maybe universities, what role can they play to ensure that they share the information to the young girls or young boys they are teaching about their rights as far as sexual and reproductive health is concerned?
The role of schools is not only to educate, but it's also to protect. And when you look at whether if the adolescents and young people that are in their premises or in their custody are aged below the age of 18, those are children.
Mm-hmm.
So automatically, the educational facility becomes a guardian or a parent to those children. So the headmaster, headmistress, school head, or whoever it may be, acts as a parent and takes up the role of a parent because they are a guardian. So away from just providing an education or teaching, they are also mandated by law to ensure that children are safeguarded, they are protected from harm, and they have information that will protect them from harm. We have life skills and health education, LSHE, formerly known as comprehensive sexuality education. And if you have a very good memory, you remember the uproar that was there a few years back.
Mm-hmm.
So the name has changed to life skills and health education. And it provides a framework that can be used to teach children and adolescents about life skills and health education. So they're learning life skills and also learning health education around sexual and reproductive health, around mental health, around gender-based violence, and around leadership. So this information is provided in schools, and where referral is required, a referral is made to the nearest health facility. That's how it works. And another angle that the Ministry of Education has taken and schools have taken is they have different school clubs. So in these school clubs, a lot of conversations are had, a lot of questions are asked, and even in those platforms, the information that is shared is very age appropriate.
Mm-hmm.
And when you look at the tertiary institutions, for tertiary institutions, it's different because the majority of people who go to tertiary institutions are adults, quote unquote.
Mm-hmm.
Though you have brilliant children and you have those that have skipped grades at 15, 16, they're in college. But the general population of these tertiary institutions is considered adults. So these institutions have clinics. They have, if you go to Yunza have a clinic, they have the HIV clinic, they have the general clinic. You go to Evelyn Horn, they have clinics where sexual and reproductive health information and services can be accessed. And it's also very easy to discuss, whether it's within the lecture theaters, lecture rooms, or classes, to discuss about sexual and reproductive health and rights. because for them they are 18 and above and are considered adults and can access this information. So when it comes to children below the age of 18, it is age appropriate, but it is given to them, and it covers topics such as puberty, understanding puberty, how to recognize the signs of puberty, how to understand defilement, for example, what is it, where can you report, what is the safety. And as an organization, we have what we call the STAR clubs. So these are school clubs that basically protect children from sexual abuse and harassment. So conversations around identifying some of these sexual harassment and sexual crimes. Information is provided in that, and where to report. We have conversations in the different schools. We invite partner institutions and also government departments to talk about sexual and reproductive health issues such as sexual violence, where to report. So these are structures that exist.
Okay. Rightly put. You've mentioned schools as a safe place actually for a young girl, and even when parents are sending their young girls either boarding or even just their school, they trust their teachers. What do you make of male teachers that sleep with their pupils?
So school-related gender-based violence is real. It exists, and this is gender-based violence that happens within the school, that happens around in areas surrounding the school, that also happens on your way to school, on your way back to school, and also happens to a learner even within the community. We recognize that it's real and it exists. Yesterday, I don't have a Facebook account, but someone was showing me a recorded call, a teacher from Western Province calling a girl, telling her to come home, and she was saying she's going with her sister, going with what? And he knows he's doing the wrong thing and he's there talking, but he still wanted her to go alone. So what I would say is, any teacher, whether it's a male teacher, a female teacher, who has sexual relations, sexually harasses a learner, is committing an offense. And what we need to understand is, in as much as it's mostly men that do it, I mean, even when you look at sexual violence, the majority of people that commit sexual offenses are men. In schools, we have reports of teachers that have sexual relations, that sexually harass learners, and this is wrong. And these are conversations that we've had even with the Ministry of Education, because what we were trying to advocate for is that there should be, in the code of conduct, in how to deal with these teachers explicitly, because more often than not, they just get transferred. What we need is for them to be charged to the full extent of the law, and also to be dismissed. Because I have a background from the YWCA. I joined the YWCA when I was 13, 14. When I finished school, they gave me my first job. And I recall how there's a certain area, my former colleague, because we meet a lot, was telling me how they had trouble in one of the districts. There's this man who kept on sleeping with little girls, sexually abusing girls, and he kept on being transferred until they couldn't transfer him anymore, and he went to sit at the provincial education office, and the organization was planning to go and protest. So for me, I have no kind words for anyone who has sexual relations with a child. We shouldn't even be calling them sexual relations. We should be calling them for what they are. That is defilement, that is sexual abuse, it's a sexual violence. So for me, any teacher who has sexual relations with their learner is someone who should be treated, who should be disciplined. Why? Because one, when you look at sexual violence, it's about power relations and unequal power relations. A teacher has power over a learner. We had an issue where one of the schools I won't mention here in Lusaka, we have some girls that are part of our Power to Girls groups. So one of them recognized the pattern of sexual harassment and knew that this teacher was sleeping with some of the girls. She confronted the teacher, and the teacher now started being cruel to her in class because she had said this. And there's nothing that was happening to this teacher until it came to us, until the girls now mentioned it in a meeting where a PS was present, and it had to be taken seriously. but it still takes time. So there's a time when the president said he wanted to meet the women's rights organizations and the gender machinery, and I was lucky to be part of that group. So I told the president, I was like, the president, you have been talking about how you despise, because the president despises this and he says it. A teacher should not have even think about having a relationship with a learner. And I said, you've been saying that, Your Excellency. But there's a school that's giving us problems, and this is what's happening. And he was very upset. He just said, can you give the details to the deputy secretary to the cabinet? But it shouldn't get to that point. So for me, I have no kind words for such teachers. They need to be disciplined, and they don't need to be around children. And one thing you need to understand is pedophiles love being around children. So they are going to get into professions that give them the opportunity to be around children. And we don't need that. That's why I support a sexual offenders register.
A register would be an interesting initiative. Let's speak to the successes that you've made as civil society organizations. I know working together with NAKES, the Gear Alliance, the Generation Alive, plus many more. You've been doing these works in Zambia and just across the region. Let's speak to the successes locally here in Zambia, even before we go to statistics, maybe across the African continent.
So for me, advocacy. The advocacy work that has been done the last few years is something to be proud of. And if Dr. Chansa is going to watch this, the NAKE's executive director, this is something that he will be happy that I mentioned, because he has been a part of those advocacy groups. And some of the successes we scored when there was the CSE backlash, we mobilized, we were knocking on members of parliament's doors in the night. We did a lot of engagement. There are people who were knocking on the vice president's office and meeting in the night and doing that. So for me, we've been able to do a lot of amazing work around advocacy. And when you look at we have the Children's Code Act, we were able to contribute to advocacy around its enactment. And those that have been in civil society for a long time will tell you it took over 20 years to enact a children's code. It's not perfect, but the fact that we have it is something we should be proud of. It can be, whatever gaps may exist may be dealt with. But what matters is we have a law. And it's a law that domesticates international instruments such as the Convention on the Rights of the Child, the African Charter on the Rights and Welfare of the Child. So for me and others around trafficking, around adoption, etc., we have all that. So for me, the advocacy work that we have done has been able to contribute to the production of results. We also have the amendment to the Marriage Act. And I'm very happy to say that some of the recommendations we made ended up in that piece of legislation. So if that's not something to show as proof of the work that has been done, then I don't know what is. The same can be said for the Matrimonial Causes Act, and right now, GEA implementing partners, including NAKES, have been part of the process around the health services bill. And away from statute, the policies, we have been able to contribute to adolescent health strategy, among others. And also around making submissions on the Education Act, and now we're already planning. We've already identified what we're very happy that free education is in the law, but we also want the free meals, the school feeding program. We want that in the law, so we're already planning for Parliament to come back and so that we can make submissions around that, because when you talk about the issues. When you talk about the barriers, when you talk about all that, you need to understand that it's not only about the beliefs, it's not only about attitudes, it's not only about poverty. You need to understand that the same poverty that we're talking about, because when I say poverty in line with SRHR, you're wondering what exactly. Apart from the transactional sex, etc., you need to understand that there are homes that are so poor children can't eat. And it's only those meals that they have at school that they can eat. So imagine there's no food at home, or there's no proper food, you're only having one meal. A man comes with 2 pieces of chicken, chips, and a little Fanta or a fruticana. Those are things that are not there. And for some, it's just food, just in Shima.
Oh, yeah.
So these are things that, as people who are privileged to be able to have meals as and when we want, I can say I'll have one meal, not because I have no food, but because I just don't feel like eating. Some people don't have that choice. You go to an area such as Mutendere. Parents were asking us and saying, what you're saying, we agree, and as parents, we will step up and we'll have conversations with our children. But tell me what I should do when my neighbor has girls who are children. They are dating bus drivers and conductors who are very liquid. And they even welcome these men into their homes, and they even call them bapongoji. They are coming with plastic bags in the morning, being entertained in the home. They have bought them phones, give them money, done that for their children. And they are able to eat. And they're saying, my neighbor is living that life. I am struggling. My child is an adolescent. And as an adolescent, it's very easy to fall into peer pressure. So my child is going to see that she has no phone. My child has no nice clothes. You can't even eat like that. Don't you think when that bus driver's friend sees her and makes and proposes to her, don't you think she will accept because she wants those things? And sometimes you have activities within the communities, and the girls are saying, "Can you buy me a phone? Can you do? My friends have a phone, and I want a phone." So, which is why we're saying, we love that we have the social protection programs. It needs to be expanded. We need more economic empowerment programs so that families can be secure enough and able to provide, and their children are not able to suffer from the consequences of coming from a poor home.
Oh, yeah. It's good. I think part of what else is supposed to be done and what is being done, your talks with parents, I think it will help. Because just the scenario you've given is quite interesting, because then what will other parents do? And for them, because when they receive that money from either a bus driver, a bus conductor, they're making a lot of money. So like, okay, we have something to buy.
They are very liquid.
Yeah,
bus drivers and conductors are liquid.
Yeah.
Cash.
Yeah. And unfortunately, on the food program, the president showed us a very good example. I think the time it started at various schools in Lusaka, you went there and other provinces. But we are seeing stories of now how other professionals are abusing the the money meant for such nice privileges for the underprivileged.
That is very sad. I've seen stories, I've seen articles, and for me, what I can say is people need to be held accountable, because the program is a very good one. And I think people are finding loopholes because it's just a policy statement made by the president to say, start feeding the children. So imagine if, like, free education, if the school feeding program was in the Education Act. It's there's a section where it's saying the government will provide meals, what, through the Ministry of Education. They are clear within the law. It means even in the national budget, it's been there, and we can even go further. And because once something in the law, you will know that if people misappropriate that money, the Anti-Corruption Act will come into play, because the law will be there, and we know what it say, what the law says when a civil servant or any person steals or misappropriates money, misapplies money. That is not theirs. So for me, I think the selfishness and greed of people who have allegedly been misapplying this money. I will use allegedly because there's no proof that they got it and no legal action has taken place. So these allegations are very serious and they need to be taken seriously. But for us, I think it just reinforces the advocacy work that we need to do to ensure that the Education Act is further amended to provide for the school feeding program, and just provide for the allocation of resources within the law. That way, people will not be able to get away when allegations such as these are made, because there are children with no food at home. They go to school hungry, and when a child goes to school hungry, they can't concentrate in class. They'll be sleeping. Sometimes they'll go and stand outside. And sometimes they'll start stealing their friends' food. Necessity. The necessity. It's about necessity. So for me, those allegations need to be taken with the seriousness that they deserve, and people need to be held accountable, because it is a school. It is a very good program, and believe you me, I think when a case study, a proper case study is done about it, and even now you can go and just interview 3 families about what they think with regards to the school feeding program, they'll be able to give you positive feedback. So for me, once we have an environment which has good laws that benefit everyone, that are enforced very well, you're able to have very good outcomes. So once adolescents and young people are able to access sexual and reproductive health information and services in a non-judgmental manner, in a safe manner, in a protected manner, you will be able to see very good outcomes. And we need to understand also that when we're talking about sexual and reproductive health and rights, we're not talking about sex generally. We're talking about everything. We're talking about even issues that intersect around it. We're also talking about issues such as assertiveness. We're talking about leadership. And what we're trying to do is prevent or reduce pregnancy, prevent or reduce unsafe and illegal abortions. You know, we are also trying to prevent and reduce gender-based violence, because some of these adolescents and young people are in relationships with their peers, and they have reported abuse. And we're also trying to see a reduction in HIV, and also an increase in services such as PrEP and PEP, and also to recognize sexual violence, where to report it without fear or favor. So it's a lot that I can talk about. But what we want is, when we have this perfect environment that we're thinking of, to have positive outcomes for our young people, for them to finish school and just actualize the dreams that they may have.
Interesting. Now, even as we conclude, we've spoken about policy. I think most of the things are at policy level, which leaves some sort of room for offenders, to those ones who would want to offend the young girls, might even go scot-free. What should policymakers, what should people in authority do, especially to policymakers? We understand, I think our Zambian government should have a new house after August, very soon. What is your message to them? What are some of the things that you as CSOs have worked on with other partners? What should they focus on into pushing them or implementing into law, so that the president can assent those things?
A few months ago, I was fighting people on Twitter. I was busy responding to everyone. Remember no bail, no bond?
Yes.
That we supported very much. We made submissions at Parliament, and we sat in there for over an hour. I think we were the group that sat in there the longest, because the MPs kept on saying, but we have Article 8, whatever article that is around the presumption of innocence.
Yeah.
And we're just like, yes, we believe in that, but we're also trying to strike a balance, and we're giving practical examples. So
that is with regard with the child.
Yes. Children, women, we're doing everything. Because for me, I would tell you that when it comes to adolescents and young people and protecting them, we have the laws. What we need is the enforcement and holding people accountable for their crimes. If you beat up a child, that's assault of a child. Section 248A of the Penal Code is going to kick in. And that one has a minimum sentence when you're found guilty of 5 years. Which is why, and when you look at defilement, our sexual offenses, we don't play. When you look at our minimum sentences, you look at our maximum sentences. For me, the NPA is doing a good job when it comes to enforcing. The police is doing a good job. But the issues that we may have when it comes to some of these offenses is the encouragement to go and discuss from home. And sometimes even before the discussion, even before a police report is made, families are already gathering and having conversations, and payments are being made, or money is exchanging hands. The law is very clear with that. So which is why we need to be, I think we need to be people who understand the implications of these violations against children on the children themselves. This is not about the parents, because if we had to do a research and see how many of families have received money from people who have defiled their children, sexually assaulted their children, or just physically assaulted their children, if there has been an exchange of money, how much of that money has actually gone to the well-being of the child?
Mm-hmm.
So for me, we have the laws, we need to enforce them, and it's up to you and I. If you see your neighbor is beating your child, or if you know is beating their child, or if you know that the neighbor is busy defiling their children, what do you do? And you're supposed to go and report as a good citizen and neighbor. Isn't that what's supposed to happen? That is what is supposed to happen. So for me, in order for us to be able to hold these perpetrators or alleged perpetrators accountable, we need to develop a habit of reporting when we see that something is wrong. You report it and the law is going to take its course. Our law doesn't play, and what we need, I think, is just a very good chain of custody for some of these offenses. And even the teachers that are molesting, they need to be dealt with to the full extent of the law.
Have we had some brave, courageous young girls who've reported
Yes.
issues of sexual abuse?
The power to girls that I was telling you about, I want to my little advocates. For them, they understand, they are very assertive, they know their rights. They can even recognize a sexual harassment from a mile away and they will report.
Mm-hmm.
They understand safeguarding and they are going to report. So another thing that we need to do, I think, the government has given us, through the Ministry of Community Development and Social Services, safeguarding guidelines. Basically telling us how we should protect children, how our institutions should have safeguarding policies, protecting children, doing all that. So you need to ask yourself, as an institution or as an organization, do you have a child safeguarding policy? To begin with, have you trained your staff on child safeguarding? If you're engaging with children, you need to understand that. So for me, I think it goes both ways. The government has given us the laws, the government has given us the policies. What is our role, apart from conducting an analysis on the law to see, is it adequate, does it have gaps, and these are the recommendations, is to ensure that we build our capacity and are able to identify where there are safeguarding issues and be able to report, and ensure that at no point is there a break in the chain of custody when it comes to evidence, because that is why some of the cases fail even when they're reported. But what we are trying to do is grow the movement of brave girls who will be able to report, who will be able to recognize the signs of abuse, and will be able to report. And we also want these adolescents and young people to be able to understand their sexual and reproductive health and rights, understand these rights, and also understand that they are human rights, and every individual has human rights that are guaranteed to them and can only be taken away when something has happened.
If you take takeaways to the young people as far as sexual and reproductive health rights are concerned, what should be their takeaway, those ones watching us?
For me, all I can say is sexual and reproductive health and rights are human rights. And by virtue of being human, you should enjoy these rights. There are laws in place to help you enjoy these rights, and there are also laws that are being drafted right now to expand on these rights and ensure that you enjoy them fully. And please do not be afraid to go to a health facility because it could save your life. And also, when you go to a facility, you are able to find peers who are qualified to respond to your needs. So do not be afraid to go to a health facility. Do not be afraid to acknowledge and recognize your sexual and reproductive health and rights. Do not be afraid to ask for more information or to ask questions, because no question is unimportant. Every question that you ask is very important. And please, if you are aged between the ages of 10 to 18, you can join our Power to Girls Club. I believe our Facebook at some point and our TikTok had provided information of how to join those clubs. So just join our Power to Girls advocates groups. You'll be able to learn a lot around leadership, around advocacy, engage with members of parliament. You can also join school clubs in areas where they are, and if you don't have a school club, a Generational Life School Club at your school, you can just reach out to us on our social media and we'll be able to get back to you. And and if you need safeguarding training, we're there to provide safeguarding training and just talk about sexual and reproductive health and rights, and just you to understand what your rights are and also how they are protected and can be safeguarded.
Interesting. Well, Thank you so much, Womba, for joining me on the Smart Podcast. It's a very nice conversation. I think we can go on and on discussing these rights. But I think for me, one of something that I've picked is the need for parents to have correct information, despite, especially in urban areas, but of course, rural areas alike, because it will help them inform or even make right decisions with regards to pertaining to their children. Yeah, because I have seen a lot happen, but I think with the good work you are doing together with other CSOs and partners, and of course with government policies and some of the things that can be done by government to help you actually achieve the work, we will have better communities that will produce actually young girls that would turn into adults who are responsible and who have their rights not abused or infringed. So thank you so much for your good work, and thank you so much for joining me today.
Thank you for having me. I can actually talk the whole day. But thank you for having me, and you are right, as long as the information is correct, as long as the information is age appropriate, and we cannot always say too much information, because information could save a life and could also help us have positive health, social, economic, and educational outcomes. So thank you for having me. And next time when you're talking about women's things, GBV, please invite me.
No, we'll surely look to your direction and invite you. So there you have it. We were discussing sexual and reproductive health rights with Womba, who is an advocate, and of course she speaks so much. She has a soft spot for young girls living in rural communities, those ones who might face barriers in terms of having or enjoying their rights, their sexual and reproductive rights, and especially those ones who might also live in rural areas facing the same challenges. We've discussed quite a lot, and we want to thank you for watching. This Smart Podcast has been sponsored, or is proudly sponsored by Elitrasmart Medical Supplies Limited, your number one provider of healthcare attire. So if you are a nurse, a medical doctor, a pharmacist, an environmental health specialist working in a hospital or a facility, or actually if you are a healthcare facility, a college, school, or university wanting to have access to those nice gowns, attires, Elitrasmart is the number one company to go to. Thank you so much for watching. See you next time.